Erin Kerwin here with Alamo City Moms blog, and we're so excited at the blog to be partnering with mom of three, Dr. Patricia Gomez-Dinger, certified allergist at Advanced Allergy, Asthma, and Immunology. That's a lot to say.
It is. It's a mouthful.
Many titles, but I love that you're a mom. It seems probably strange, right, that we are in this beautiful field of blue bonnets, but there's a reason for that. All of this beauty signifies something more, doesn't it?
It does. It's a really good indication of what's to come. Lots of heavy pollen predicted for this coming summer and fall.
Oh, I know. I already feel it in my eyes, especially I'll have a headache by 3 or 4 in the afternoon. You touched on some of the symptoms. What are most common with oak and hackberry right now?
Most common symptoms we see in the spring are the eye symptoms, so those itchy, watery eyes, the swelling, the watery eyes. Along with that, though, is also the runny nose, the sneezing, the itching, the postnasal drainage, coughing. Sometimes we have patients that come in and they've got a full-blown sinus infection.
Are babies, infants, are they feeling what we are, or does that start later on?
Well, I think what's important to understand is that you can't develop a seasonal allergy, so allergy to the oak or mountain cedar or ragweed for that matter, until you've been exposed to it for 2 seasons. Prior to, you can still have allergies, but that's usually going to be from perennial things like dust mite, pets, and molds.
Through your 7 years of practice, you've come up with kind of a favorites or a cocktail of combination of what we can do to treat these symptoms. Tell me what you have.
So I've come up with this concoction based on the fact that I myself, when I moved to San Antonio, developed allergies. So I treat not only as a physician and according to the guidelines, but also as what I've experienced myself. So I know for sure that doing sinus rinse works really well. It's a natural remedy, warm salt water, very helpful in decreasing all that inflammation and washing away all that pollen. The other things are, of course, the steroid nasal sprays. So a lot of times moms are afraid when I use the word steroid, and it's absolutely nothing to be afraid of, because a steroid nasal spray is no different from using hydrocortisone on a rash. It's topical. It's not getting into the bloodstream, so we're getting very little systemic absorption, and it's first line in treating nasal allergy symptoms. Q nasal, which is my personal favorite, you can see that when I spray it, and you can kind of hear it's an aerosolizer, right? Didn't mean to get you. Yeah, you should be feeling better now.
Right.
Now you actually have to put this in your nose, and they've done testing on this and have proven that that size of the nasal opening will fit in ages 4 through 11.
Okay, Dr. Dinger, thank you so much. I feel like we should go take a picture in the blue bonnets, because that's what everyone does.
That's what everyone does in the spring.
For more tips from Dr. Dinger or information on advanced allergy, asthma, and immunology, go to www.myasaallergist.com.